My name is Kristen. I have 4 children, all of whom have been diagnosed with some form of autism.
So there's a lot about autism that hasn't been discovered yet, and from the little research that we did before this, we did see that it's more common that older parents have children that are affected by this, but this isn't the case with you. You were a teen mom, actually, correct? Mm-hmm. Could you tell us a little bit more about that?
So yeah, I had our oldest son when I was 17, and so that was quite difficult, obviously, to be a teen parent. I mean, we had struggles like anyone else, and then 2 years later, we had our second son. So those early years, as anyone can imagine, while I'm still in high school and then into college, were quite difficult years, as one can imagine.
So your oldest son is now 16, and at the age of 10, he was diagnosed with what was called then Asperger's. Mm-hmm. They call it now Autism Spectrum Disorder. So for Trent, what does this mean as a child?
So for Trent, I mean, he was typically developing all through the years. He was meeting all his milestones. We thought he was typically neurodeveloping. When he went into kindergarten was when it really became apparent that maybe something was wrong. And it's hard to not tell about other children when we're talking about this. I know we're talking about Trent, but a lot of other things were going on with his sibling at the time, so we were kind of taking other things and maybe it's this, maybe it's that, a lot's going on in our life. But he was having a lot of difficulties when he went to school, and so it started at school. And we just started to see him kind of deteriorate when he had to be socially involved with others. Because at home we didn't really see it because he felt, safe with us. But it was when he went into that, kind of unsafe place that he didn't feel normal, was when it really started to come out. And so as years went on, we just started to think he was being a bad kid. And until we really started to look at it, from an outside view, and from talking to his doctors and stuff, they're like, we might actually be dealing with something else, Kristen. We might be dealing with autism with him as well. And we're like, what? So it was unfortunate. Years later.
You just mentioned that you had another son and it was hard to talk about Trent without talking about them first. Does this mean that Trent was diagnosed after?
Yeah, so Trent was diagnosed many years after Dylan was diagnosed. Dylan was diagnosed when he was 2 years old. So he's only 2 years younger than Trent, and he had seizures very young, and his behavior was very apparent. He had the classic symptoms of, having his milestones and then, having some retrograde of his normal. It was very obvious that he was not neurotypical. So I think early on we were working with the clinicians and his doctors very early on with him. And so for a lot of time, I think, unfortunately, while we were focusing in on him and dealing with seizures and meds and all of these things, Trent a little bit got pushed to the sideward a little bit. And so we didn't really know if that was what was going on with Trent. Were we dealing with, a kid that needed a little more attention, lagging from that, seeing different things going on with Dylan. So Dylan was diagnosed many years earlier than Trent. So that is how it happened. Years later, Trent got the diagnoses that he must have had many years before Dylan, but got it years later.
So to bring us back to Trent,
Mm-hmm.
He's a 16-year-old boy, high school.
Yes.
What is Trent like today?
Yes, Trent is very black and white still, does have some social issues, absolutely still. That's usually his biggest issue. But he is very sweet and loving. I know a lot of times they're like, oh, do they have emotions? Do they show love? Yes, he very much does. He is active in his ROTC at school. He's in National Honor Society. I'm trying to think. He's dual enrolled right now to graduate high school and hopefully get a high school diploma and his college diploma at the same time. And he's thriving. He's doing very well. He, however, does not like to be associated with his diagnoses. He feels it limits him. He does not like to be associated with the things that he sees limits his siblings, and he sees Dylan as much more low functioning, which he is. And so when we talk about autism, although he understands he's being diagnosed that way, he does not like to talk about that he has autism.
So your other son, Dylan, who's 14 now, is on the lower side of the functionality of the spectrum. What is days like for him? What is his day in, day out? And how does it differ from, his other siblings?
Yeah, that's a great question. He very much differs from his siblings. His day starts usually very early, and he usually wakes up the whole house. He has to get his meds early to start his day just so he can be functionality, so he can have any type of function. He starts with that. Often we argue through getting dressed, through brushing our teeth, through all the things we have to do to even get our day going. Everything is an argument usually. It's not usually a day we're like, yeah, sure, I'd love to brush my teeth, I'd love to get dressed. It's always like, why do I have to put my shoes on? But why do I have to do this? Every day is that, ebb and flow of like, how many things are we going to argue about doing before we get on the school bus that arrives to the front of the house? He rides the special needs bus, so they pick him up, he goes to school, he's in a self-contained special needs class, so I think he's best served there. And when he gets home, most often his therapists are already at the house or waiting on him or soon arriving. So he does multiple days. He gets one day off in a week where he doesn't have therapy, and he'll have an hour or two of therapy a day. So we may or may not be involved in that or the rest of our house, but he has to go from school to therapy, and then he also has an aide that comes to the house 5 days a week. Will also help him get organized with his, his ADLs, his bathing, his cleaning, trying to get him settled in for bed, because that is another struggle, because now meds are wearing off and we're starting our nighttime med routine. So the days are long and hard. He struggles every day. His life is a struggle for him, but we get through it every day.
With Dylan, what were some of the earlier on indications that made you initially even go to the doctor that, something was different or something was off?
Yeah, so we were really enthralled in just deep dealing with seizures for a moment. And so like I said, originally he was meeting his milestones. He was saying words. He was doing things that we thought he should at certain ages. So we were hyper focused on seizures and finding out what the cause and things with that were. And my sister and I were both in nursing school, so we were like hyper focused there. But at one point we were talking about a banana, and he used to could say, however, he said banana, and he couldn't articulate that word anymore. And it was kind of just like that's weird. He used to say that. And we moved about our busy life, and then came back into a different day. He used to could say Grammy or some form of that, and then couldn't say that. And we're like, what's going on? And we just started to kind of then piece little tiny pieces together over the course of time that were like, we've been focused on something else, but something greater is going on. Behavior was an issue. He was flapping hands, which we didn't know was a big deal at that moment. He stopped looking at people in the eyes and more just kind of like in a different world. But like I said, we were kind of, our focus was somewhere else. We were trying to battle a different battle at that moment. So I think when we all kind of came together as a family, our outside family and everything, we were kind of like, what's going on? My sister-in-law, I believe, were the two people that were kind of like, hey, you guys ever seen Rain Man? They kind of threw that at me. I'm like, no. And we kind of started talking about autism, as a family. And I was like, I'll look into it. So I started looking into it, and I was like, wow, this sounds a lot like Dylan, and that's kind of scary. I printed out a survey about what it was. I told my husband, and he's like, absolutely, Dylan does not have, autism. I sent him the survey. I printed it out, and I said, read this. And he's like, oh, that's Dylan. no, that's not Dylan, that's autism. And that was the moment we knew before we ever had the formal testing. I mean, we knew.
Yeah. I know it's not always easy for someone, you know, especially family members, to bring that up to you, you know, to the parent that, you know, maybe your kid, there's something actually wrong. You know, was that hard for you to hear? Did you take it? You know, did you get angry at them initially?
I think I was more hurt than angry. I'm thankful they said something, because I think we could have went years longer, because we were, like I said, we were thinking about other things, dealing with other things. So I'm thankful, you know, that they knew that I would not be mad, but be sad, or be, you know, I was lost. I was upset anyways. I didn't know what was wrong with my kid. Something was wrong. I didn't have a name. I didn't have a diagnosis. But there wasn't something, right? And so to call it something and to have an idea, I'm like, oh, okay, we can deal with this. We just now have to fight a list and get the diagnoses. You know, that turned into a bigger issue. But we had a clear-cut path, at least, you know, and if they didn't say it to me, how much longer would it have taken for us to get that? Because even though his doctors were working with us, they also didn't say those words to me yet, albeit they don't spend as much time with us as, you know, as our family had. So, I mean, I'm thankful at this juncture. At that juncture, when I was hurt, of course, to hear those words. Nobody ever wants to hear anything's not normal, or, you know, with your child, who would.
Your next son, Caden, he was diagnosed at the age of 5. He's 9 now. So, you know, what is the difference between Caden compared to Trent and Dylan?
By the time Caden came around, I think we were pretty well versed in at least the community, at least what we should and should not be looking for. And we had the relationship with our pediatrician at that time that we were kind of seeing the same type of behaviors that we had seen in the other children early on. And at that point, he's like, I have enough data to diagnose Caden at this juncture. We can do that now, or we can continue to monitor. And at that point, I said, what difference will it make? We're already have him in social skills. We're already doing therapies and things with him. Is that going to change anything? He said, no, because you know what you already know. And I'm like, okay, then let us continue on. You know, we moved to Tennessee, and that's when we needed an actual diagnosis to get him situated in our current school system. So then we went the route of actually going to a formal diagnosis. So for him, actually, we knew of a diagnosis without having it many years prior. But it was always the chicken before the egg. And it was more kind of like, is it nature versus nurture? Is he learning behaviors from his siblings? Well, that's something I cannot remove from the situation. I can't take his siblings out of the equation. So do we wait and to see how he does when he gets in school by himself, socially, emotionally, physically? Or do I continue to just sit back and say, okay, we'll just see how this goes, you know? And that's kind of where I was trepidous. And, you know, like I said, I worked with that pediatrician for many years as a nurse, and he was just like, Kristen, this is on you. You guys already know. You know, it's what's better for Caden right now. And I said, we already know. So we'll just wait and see if he grows out of some of these behaviors. And, you know, unfortunately, he never did. And, you know, we got the formal diagnosis so that we can continue on our journey.
So lastly, we have your daughter, Brean. She is 4. And we know that doctors typically don't like to diagnose on the spectrum until they're about 5 years old. So, you know, obviously you're used to seeing this throughout the rest of your children. You know, what is it about her that concerns you, you know, for her to get tested as well?
For her, she showed some really early signs of being quite intelligent. And again, you know, meeting milestones not only on time, but early. So we're like, oh, yay. We've got it this time. We're going to be okay. Also, I don't know in your research if you saw, like, girls are less likely to be on the spectrum than boys. So we're like, okay, another check mark in the good box. You know, we finally got a girl. Also, you know, just like many different things that we're like, okay, I think this is the one. You know, this is the one that maybe won't be on the spectrum. And so we were really excited about that and happy. But her behavior really is what got us. I mean, she literally can have the grandest of all tantrums, and I know it's like, okay, well, she's just a spoiled rotten brat, and we created some of those problems, and I have to like step back and be like, okay, I did say she was a princess for a while, and now I'm trying to like, no, you're not. But she climbs the walls, like literally. She has to have so many hugs and kisses. She won't look you in the eyes. She flaps her hands. And then I bring that up to her doctors, and they're like, oh, maybe she got it from her siblings. I'm like, her siblings don't flap their hands anymore. Those were years ago, before she was ever a thought in her mind. Mm-hmm. Some of the things, again, it's like some of these can't be learned because she has nobody to learn them from. And so that's like my fear, is that she also has these innate behaviors because they're hers. And as much as my experience and my research is that it's more and more in families, and quite honestly, obviously I already have 3 out of 4. To have 4 out of 4 wouldn't be too absurd. Mm-hmm. To have the same 2 parents for all 4 children, that you're saying, okay, all 4, have mm-hmm. some form of autism. And we've already done some evaluations with her, and the early evaluations, they saying she didn't completely do all of the testing properly because she either refused or didn't respond well. And so that's why I think it's harder to diagnose at this age, but we're like, come back in some more months, and it's just like, really? But red flags is always like the term thrown around, and we're like, okay, well, we've been hearing that since she was very young. Red flags for autism, red flags for autism. But the new thing, they're throwing red flags for OCD, and that kind of also makes a bit more sense. And they diagnosed her with social pragmatic communication disorder, which is the social piece of autism, and they've already said that she has more than enough data to support that diagnosis, but not a full autism diagnosis at this juncture.
So these diagnoses are important for schooling reasons?
It's important for schooling, more so at least you have a plan that you can go in saying, we know we have these difficulties, mm-hmm. So these are the skill set that we have, these are the plans that we need made in place, so that you can get an IEP, an individualized education program for your child. So that's where there's goals specifically for your child and their specific needs, and that's by law, so that the teachers and the aides and everybody working with your child actually have to use that as their gauge on what your child is able and is not able to perform. And it's set with goals, and you meet regularly to go over the goals and change and do. So that's important. The other piece and the other caveat to that, and why a diagnosis versus not, and everybody has their own opinions on that, is to get therapy. And early intervention is always the best, but without a diagnosis, it's much harder to get insurance to cover and pay for it, because at that point you don't have anything to base it what you're getting therapy for. So that's always been at least my experience in doing this.
So bringing things kind of back to yourself, we had the chance to speak with your sister. I know that you and your husband both put each other through school. You were in school while he worked, and he was in school while you worked. And you are now a pediatric nurse. But not only are you a pediatric nurse, we also heard that you're a preceptor, which is a higher level that you can get to, which is awesome. So congratulations. So if you could just kind of tell us how your job affects the way that you care for your children. You're in pediatrics all day. How do you bring that home with you, and how does it affect everything?
Yeah. So my children and the difficulties that I face every day, day in and day out, definitely shape the way that I care for the children I provide care for every day when I clock in and out of work. So I found many opportunities to teach others how to have compassion. There's been, I wish I could count how many times that I've had a nurse make comments that were derogatory on a diagnosis alone, crazy, autistic, schizophrenic, this, that, throwing all these terms around that are so derogatory. And I have to reel it back in and say, oh yeah, tell me about that. Oh, I have some at home. Yeah, tell me. And Jaws drop, and then you have to like, oh, let me help you with that. And then I'd be like, oh, for my children who are on that medicine, I just use it as a way to help grow and learn, because I feel like the teachable moment is all I can do in that time, because I can't be upset about the life that I have. Sometimes I wish it was different, but every day I go to a place where children still need me to care for them, and they need me and every nurse that they come in contact with to have compassion and love for them in their moment, in their deepest and darkest times that they're there for. So regardless of any diagnoses, any label, any medicine they're on, anything, if I can give any knowledge I've obtained on all these years and all these struggles I can talk about for hours with my children in all the years, if I can pass that little nugget of information to another nurse, and they don't have to live the life and the struggle I have, but can use that to better their life and their nursing skill, I give it freely.
Wow, that's really, really incredible. Thank you. Wow. We're planning to dive a little bit deeper with you afterwards in our podcast, but kind of to wrap things up, we like to have our guests give a word of advice. In this case, do you have anything that you could give to maybe a parent or a guardian that is in your situation that does have a child or someone that they're caring for that is on the spectrum?
That's a great question. At this juncture of everything, I feel like having your village. You can't do this alone. I can't do this alone. I've tried to for many years, but I need the help of others to provide the care that they all deserve. I'm fortunate enough to have my husband. I have extended family who love them. I have my mother who lives with us and gave up her life to move with us and help care for them. But find your village, whoever they are, wherever they're at. They're there. Get them, and find some time for yourself. I struggle with that all the time, but it might be my 30 minutes at the gym. It might be my drive home. It might be a 30-minute phone call or 10 minutes in the bath while I'm reading a book. But you have to find some time to decompress, to be able to deal with all the stressors that come with this, because this is a 24-hour, 365 gig, and I know all parenting is. But this one comes with some hefty and difficult roads and turns, and some ones that come very emotionally charged. So have your village, keep them close, know when to ask for help, and know when to take time for yourself. And that took me so many years to figure that out.
On behalf of myself and the team, we just want to thank you for taking the time. I know that you flew out here and took some time out of being around your children, and we are so grateful for you to come here. We really think that the things that you have said and the advice and the awareness that you're giving can really change someone's life. And then for those of you that are watching, we are going to put some resource links in the bio, so be sure to check that out. And if you have any questions at all, please feel free to reach out to us. We will be in contact with Kristen, and if something comes to us that we can get to her, that will be great as well. So thank you.
Oh, thank you for having me. I'm so happy to be able to be of help to anybody. If I can help one person or even just help myself, sometimes it's all about helping yourself heal too. So I appreciate you letting me tell my story.
Of course. Thanks.
Once I was 7 years old, my mama told me, go make yourself some friends or you'll be lonely. Once I was 7 years old.
For the haters, come on, do it now or later. Yeah. It don't matter what your name is, share your story, we'll be waiting.